When it comes to Medicare, it's very important to understand that it has 4 parts: Part A, Part B, Part C, and Part D. If you're the individual watching this video, you may have a ton of questions, or you just may be confused, or it may be very overwhelming to understand this information when it comes to Medicare. My objective over the course of this video is to make sure that you finally get it. We're going to break it down and make it make sense to you so that you can finally have the proper understanding and knowledge so that you can make the right choices when it comes to your Medicare health insurance. My name is Brittany Garrison. I'm a licensed health insurance broker, and I'm excited to be able to help you today. All right. So first, we're going to start talking about Medicare Part A and Part B. Medicare Part A and Part B is what we consider traditional or original Medicare. It is considered that simply because of the fact that these 2 parts of Medicare have been around since Medicare originated, okay? So when it comes to Medicare Part A covers your hospitalization. That's your inpatient hospital care. That's your skilled nursing facilities, hospice, and home health care. It is very important to note that this does not cover long-term care, as that is considered custodial care. It's also important to note that it has no premiums. Part A does not have a premium if you have worked 10 years or 40 quarters, or you have a spouse that meets that same criteria. Now, it's also important to note that Medicare Part A and Part B, and I'll get to Part B in a second, it's important to note that this only covers 80% of your overall cost, right? Which means there's 20% that you are now responsible for in co-insurance, co-payments, deductibles. The deductible for 2024 is a little bit over $1,600. And so and that's per benefit period. Now, what is a benefit period? A benefit period is how original Medicare measures your utilization of your hospitalization or your skilled nursing facilities. A benefit period begins the day that you're admitted into inpatient hospitalization or a skilled nursing facility, and it ends when you haven't received care for 60 days in a row. And in 2024, the deductible for your Part A is $1,632, $1,632. Now let's talk about Part B. Now, your Medicare Part B covers your medical services. So this is your doctor's office visits, your outpatient hospital services, preventative care, durable medical equipment, wheelchair services, ambulances, clinical research, and mental health services and things like that. So that's what your Part B covers. Now, a lot of individuals are surprised that their Medicare Part B does come with a premium, and that's $174.70, although it may be higher based on you being a high income earner. Now, additionally, it does have a deductible, an annual deductible of $240. Once that deductible is met, then your Part B begins to pay that 80% that I talked about before, and you are then responsible for 20% of your services. Now, unless you have a supplemental plan, or we'll talk about that a little bit later, it will cover some of those gaps to where you now are able to fill in that 20% and have something covering that for you. So who's eligible for Medicare? You're eligible for Medicare on the first day of your 65th birthday, although there are individuals that are under 65 that will qualify for Medicare based off of disabilities. Now, you do have to enroll in your Medicare Part A and Part B during your initial enrollment period, which starts 3 months before your 65th birthday, your 65th birth month, and then 3 months after your 65th birthday. It is very important that you enroll during that enrollment period to avoid any penalties. What if I'm still working at the age of 65? Well, you can delay your Medicare enrollment if you are still actively employed and have active employment insurance through your employer, and your employer has 20 employees or more. You can delay your initial enrollment of original Medicare without any penalties. Now, when you decide to retire, you then have an 8-month window to then apply and get enrolled into your original Medicare without any penalties, utilizing the special enrollment code. So Medicare Part C is what we call Medicare Advantage. This is managed care plans. These are private insurance plans with companies that have contracts with the federal government. This is an optional service that you may or may not want to take advantage of, right? This provides an additional alternative way for you to receive your Medicare Part A and your Part B coverage, and sometimes Part D, which I'll go over next. But what that means is you now have private health insurance through a specific carrier or company that now puts you in either like a PPO or HMO. What's the difference between the two? An HMO means that you have to operate within a specific network of carriers, a network of providers, of individuals that are specific to that network. You often need referrals to different doctors, and a PPO just gives you a little more wide range where you can go to those doctors within network, but you can also see doctors outside of that network. Now, in order to qualify for a Medicare Advantage plan, you do have to be enrolled in Medicare Part A and Part B, and you do have to continue to pay your Part B premium. Now, Medicare Advantage does cover the same services that both your Part A and your Part B do cover. However, these companies are able to set their own co-pays and co-insurance and cost shares that you are now responsible for. Now, Medicare Advantage plans do come with additional benefits that you would not normally get with just your original Medicare. Things like dental, vision coverage, hearing coverage, over-the-counter benefits, food and grocery benefits, fitness benefits, transportation benefits that you wouldn't normally get. Additionally, most of these plans also come with Part D prescription drug coverage. Most of them come at $0 cost. And so for some individuals, it makes sense to have that all wrapped up in one pretty bow. It is optional coverage, right? It's not something that you have to have, but for some people, it's a great option to be able to encompass all those things as well as to get some additional benefits. Now, speaking of Part D, this is your prescription drug coverage. This covers your medications, right? And for some Medicare Advantage plans, they include your prescription drug coverage. Now, your prescription drug coverage is that, your prescription drug coverage. It's what covers the drugs that you pick up from your local CVS, Walmart, Walgreens, Costco, wherever you pick up your local drugs. Now, you can get a Medicare Part D plan either standalone, so by itself. We call those prescription drug plans, or you can get one encompassing a Part C Medicare Advantage plan like we just talked about. Now, Medicare Part D plans are specific on what actual prescriptions they do cover. However, most of them cover most generic and name brand prescriptions, as well as these prescriptions that I will list here as well. Now, they do come at a price typically. Now, even the lowest price point does cover the majority of those medications. Now, your Part D does cover some vaccines, just like a shingles shot that may not normally be covered by your Medicare Part B. If you delay your Part D enrollment and you do not have credible prescription drug coverage, you could face lifelong penalties for late enrollment for your Part D. So even if you're not taking many medications or no medications at all, it is important to find even a low-cost prescription drug plan so that you can avoid those penalties. Now, when you're turning 65, there's going to be a ton of information about two categories: Medicare Advantage plans and Medicare supplements. There are going to be a ton of phone calls, commercials, advertisements telling you what it is that you qualify for. It is very important for you to know that they both have pros, they both have cons. It's all going to be specific to you. A Medicare supplement plan works directly with your Part A and your Part B, as well as we already talked about Medicare Advantage Part C. And so it's going to be specific to you and your needs. The best thing that you can do for yourself is make sure that you speak with a licensed professional on your situation and get some information and some credible knowledge as to what is going to be the best route for you. And so if you're somebody who's looking for that information, I am a licensed professional. You can reach out to myself, Garrison Global Management, at 470-775-9455, or you can submit inquiry on our website at Garrison Global Management, MGMT, GarrisonGlobalManagement.com, and one of our licensed professionals will get back with you so that we can have a conversation and talk to you about exactly what it is that you qualify for and exactly what route that may make the most sense for your situation. So my name is Brittany Garrison, again, the licensed health insurance broker, and I hope that this makes a ton of sense to you. Drop in the comments any questions that you may have had and any information that you may want me to continue to elaborate on so I can make an additional video and make sure we talk to you as well. So thank you so much for tuning in, and I'll see you soon.